Thank you so much for making the time this morning to continue on our conversations that we have been having. I started out doing this thing like an experiment, you know. I said, okay, I'm just gonna try this out on YouTube, see um, what the response is. Basically, because there is not a lot of content created by Papua New Guineans to be consumed by Papua New Guineans regarding like health issues and crime and all these things that people post on social media, but there is no engagement with like experts like yourself or others there, and the Facebook seems to be the way people are venting out their frustration, but there are other effective ways to you know make those little issues, move up the rank of priority for the government. So maybe someone there will take notice. Thank you so much this morning for making the time to join me and continue what we are doing.
Thank you. I've been passionate about it, and I've been really blessed by your energy and your want to do this, because as you just expressed, not many people want to do this. And there are fundamental reasons for this, I think. One is that people are shying off the truth. They're really shying off talking about facts because the facts appear to be the truth. Sadly, older people like us have seen this or are seeing this. At least I am seeing this quite clearly by the fact that you get shunned, you get put away because you're just basically trying to do the right thing. So sad to say that people at all levels, particularly leaders at all levels, are beginning to engage in this without talking about the truth about our country. Truth is that we are so diverse, there's no country like Papua New Guinea. And it is only Papua New Guineans that have lived with it, gone through it, that can at least make a little difference to ourselves and our people. Sadly, we tend to be thrown to the side. And your expression really touched me because that's what we are feeling right now as the elderly people that have been through the system from Stone Age to Space Age. We've been through that. And I believe not, and we'll be like, I guess, extinct soon, the people like us. And if we're not careful, we'll not be able to see or feel the feelings we have based on the experiences that we've had. And what you're saying just now, articulated just now, expresses that fact. Many Papua New Guineans are not seeing those facts. Many people of my age have not been able to express it because they get shunned off. We retire, we die, and we get forgotten about. And I guess I'm not saying it by, I'm not a man of fighting brossin. We don't show off about things, but we just focus on the facts. And thankfully, with your input on medias like this, we can express some of those feelings rather than being just shunned and, put aside, and we just wait to die, I guess. Sorry, but that's what I'm feeling.
Let's begin our main discussion point for this afternoon, and that is the PHA system. I think I want to start by asking you, what was the reason for the change from the old system to the PHA system? And what was the reason, and what key differences are there between the system that was just prior to the PHA system that was introduced?
Thank you very much. First, I must acknowledge late Sir Peter Bata, who was the political leader at that time that made those political decisions to make a shift. And 2007 is when I was just engaged as Secretary for Health, and he was just exiting as the Minister for Health. And it was that time that we had our the policies started on the Provincial Health Authority. There are just very, very basic reason. the minister saw, and then we had Sir Peter, Honorable Sasazibe become Minister for Health. So I became his secretary, and we discussed and said, look, there were obviously, it was really visible and experienced that at that time the hospital boards now, the PHAs the hospitals were run by CEOs of hospitals themselves. And the provincial health was run separately by provincial health authorities at that time. So there was total difference of actual implementation capability, because the hospitals were confined on clinical health services and the rural health services were done by themselves. So the basic idea was to bring them together and allow a single authority to make sure that that single authority had services provided to the people in the remote rural areas. That was the basic reason. So seeing that, we, as part of the process of the development of the new plan, we set up, ended up having the National Health Service standards developed, so that one would have a clear delineation of roles and responsibilities. At that time, we had 7 different health facilities, which would have, at each level, we had, at that time, 3 regional hospitals, and you can now work out, community health post was one of the ones that we just created that focused on rural health, child health, and maternal health. The community health post concept was designed for that. But then, as getting back to the PHA, the basic rationale was for the provincial health authorities to be able to articulate these standards at each level of facility. So in each province, there would be the provincial health authority that would articulate clearly the standards of services based on the national standards. The national standards would set the basis for each provincial health authority to operate effectively for rural health services. That was the basis for us developing the new provincial health authority concept.
So in other words, so you match these 2 different entities who were operating the health system into one umbrella entity, and now we calling it PHA. Would that be correct to say that?
Correct. So that you'd have a provincial health authority that will manage both the rural health and the hospital health services properly, collectively together, in order to execute services, both clinical and rural health, public health and clinical.